Preview.
Marine Envenomations, Jellyfish and Hydroid Stings by Joseph Becker and Paul Auerbach. Some of the most beautiful and seemingly harmless marine invertebrates are amongst the most hazardous. Snorkelers and divers may unintentionally come in contact with free-swimming jellyfish or touch hydrozoans such as fire coral while they're exploring reefs or wrecks. Occasionally people might be stung while handling or stepping on jellyfish that have washed ashore. Although many envenomations are mild, some marine invertebrates produce incredibly potent toxins that can cause serious complications and even death. There are some general treatment principles, and the four main classes considered in this article are those that apply to hydrozoans, such as the Portuguese Manofwar and fire coral, the scyphozoans, or the true jellyfish, the anthozoans, including stony corals, soft corals, and anemones, and the cubozoans, or box jellyfish, including Chironex fleckeri. Each of these classes is armed with stinging cells, generally known as nematocysts. Symptoms of envenomation depend on the species, venom dose, and body location. Immediately after a suspected jellyfish or hydroid sting, rinse the affected area with household vinegar, that is acetic acid in a 5% solution. If vinegar is not available, use seawater or paste of baking soda. Hot water, which is to the victim's and caregiver's tolerance, heat packs, cold packs, or ice may also provide some pain relief, but do not place ice or unheated fresh water directly on affected skin. Remove any tentacle fragments, but take care to avoid contact with fingers or hands, and wear thick gloves if possible. Rinse again with any remaining vinegar. Then hydrocortisone, half to 1%, in either cream or ointment, may be applied twice daily to the affected area until the signs and symptoms of the envenomation disappear. In some cases, a doctor may need to prescribe a stronger steroid combination. If the area appears infected or the victim develops fever, discontinue the use of any steroid and seek medical care. Complex or significant envenomations, which are those that produce so-called systemic symptoms such as nausea, vomiting, shortness of breath, or confusion, require immediate evaluation by a physician. After an envenomation, it is possible for individuals to develop an allergic reaction, which in some cases may be severe. Anaphylaxis is a potentially deadly allergic reaction, and that can involve respiratory distress, airway compromise, and other unstable vital signs. If anaphylaxis occurs, immediately administer adrenaline or epinephrine with typically an EpiPen or twin-jet auto-injector or the equivalent that is locally available. Provide oxygen and antihistamine diphenhydramine, Benadryl. All patients suspected of having serious allergic reactions should be treated immediately by a physician. A physician may administer prednisone or other medications. SafeC, a topical jellyfish sting inhibitor, has been shown to be effective in diminishing or preventing certain jellyfish stings. But care should still be taken while swimming or diving into jellyfish-infested waters. Protective clothing should be worn and a wide berth given to all jellyfish, because tentacles may trail for several meters behind the bell and main body of the organism. Gloves may help protect against hydroid and anemone stings. Some additional information on box jellies. The most well-known box jellyfish, Chironex fleckeri, is perhaps the most venomous creature in the sea and can cause death within minutes of envenomation. Although box jellyfish are most often found in quiet, protected, shallow areas, chiefly in the waters of northern Queensland, Australia, they may also be found in the open ocean. Death is attributed to shock, respiratory paralysis, and subsequent cardiac arrest, which may occur in 15 to 20% of cases. With any suspected jellyfish sting, the victim must be assessed rapidly for adequate breathing and supported as necessary with artificial breathing and oxygen. The person should be moved as little as possible. The affected area should immediately be flooded with vinegar for at least 30 seconds and preferably a few minutes before any attempt is made to remove adhering tentacles. This can neutralize nematocysts somewhat and helps lessen the ultimate degree of envenomation. Severe pain and rapid development of wheals, blisters, and reddish-purple tentacle markings are likely. In certain areas, such as Queensland, Australia, an antivenom is available in hospitals and at sub-beaches, where lifeguards may even be trained to administer it by intramuscular injection. Portuguese man-of-war. Phasalia phasalis, known in the Pacific as the blue bottle, is not a true jellyfish, but really a colony of organisms. The man-of-war floats in the open ocean, typically in warm waters, without any means of propulsion. It relies solely on currents and winds. Man-of-war stings usually cause severe pain and leave whip-like red welts on the skin. Other reactions can include fever, shock, cardiopulmonary failure, and in very rare cases, death. Although painful, man-of-war stings often resolve on their own. Affected areas should be rinsed with seawater and certainly avoid fresh water. If symptoms persist, worsen, or show no sign of improvement after several hours, or if there are any systemic symptoms such as fever, confusion, nausea or vomiting, seek the care of a physician. Fire coral. Fire coral are hydrozoans rather than true corals, although, like corals, they are immobile. Fire corals have nematocysts, but also have sharp edges that may cause laceration and abrasions. Symptoms of fire coral envenomation include immediate stinging and burning. A skin reaction involving red wheals and blisters may develop along with considerable itching. Fire coral envenomations should be treated according to the general principles described in the beginning of this podcast. Sea bather's eruption. This skin irritation mostly occurs in covered areas of the body because the larval forms of certain sea anemones come in contact with the skin. The skin manifestations may occur within minutes or hours of swimming. The reaction is typically red, burning and itchy, and forms bumps and hives that may persist for up to 2 weeks. Treatment consists of washing the affected areas with soap and water, followed by a vigorous rinse. An initial brief soak with vinegar may help to reduce the symptoms. In closing, jellyfish and hydroid envenomations are frequently painful and may occasionally cause severe illness. Careful employment of techniques involved, as well as an effective evacuation plan and knowledge of local medical facilities and resources, including the availability of any antivenom, can reduce pain and may be life-saving.